Hello, good evening, everyone from Florida, USA. Welcome to Humanly Possible channel, where if it's humanly possible, we may be talking about it. Humanly Possible's mission is to bring the children's perspective and talk about the long-term effects that parental abduction and parental alienation has on children throughout their entire lives. I am Dawn McCarty, and I'm an adult survivor of abandonment, parental abduction, and severe parental alienation. These topics are our primary focuses on this channel. And as we talk to more survivors like us and share our stories, we hope to inspire others to come forward and share their stories as well. Humanly Possible provides a safe space for adult survivors to come forward, to speak, and to be a voice for children and future generations. We will speak to survivors as well as experts who have studied parental alienation in depth and take a place at the table on solving and preventing parental alienation. That being said, tonight we have a very special guest. His name is Dr. William Bernet. He is a professor emeritus at Vanderbilt University School of Medicine. And he is also a forensic psychologist and has testified in over 300 times in 24 different states. Dr. Bernet wrote the book Parental Alienation, DSM-5, and the ICD-11. He and his colleagues have also edited the Parental Alienation, the handbook for mental health and legal professionals, and has also published the Parental Alienation Science and Law book that was just released here in 2020. Dr. Bernet is the founder and the first president of Parental Alienation Study Group. And I have with me my very special co-host, Alyse Price-Tobler. Alyse, I'd like to pass it over to you for a minute so that you can introduce to our guests and give them a little bit of information, background on you, and then we can get started with Dr. Bernet.
Okay, thank you, Dawn. Thank you. Thank you, everybody, for tuning in and listening to us. It's actually morning over here in Australia. So, and welcome to everyone across the world, whatever time zone you're in. It's our very great pleasure today to have Dr. William Bernet with us on the show. And the book that I just held up is one of the books that he's helped to write. It's I haven't got my new edition yet due to the COVID. It's taking an extremely long time in the mail, but Dawn has her version at the back. We could possibly show you a little bit later. And I would just like to introduce you all to Dr. Bernet, and welcome, Dr. Bernet, to our show. We are so grateful to have you here. Yep. And we would just really like you to take over for a little while and just tell us a little bit about yourself, if you wouldn't mind.
Well, thank you very much, Dawn and Alyse, for inviting me to this event. It's really neat to hear about it and to participate and to get some input from your listeners. And so I'm glad that we're able to do this. So, you know, parental alienation, of course, has been around for centuries, I suppose, and it was officially named in 1985. But just to make sure that we're all on the same page, you know, I give a lot of presentations, and I almost always start with the definition, because people do have different definitions for parental alienation. But let me give you mine that I've been using for about 15 years now. And the reason why I emphasize this is, even though there are some controversies among some of the professionals, that almost everybody, as far as I know, this is a simple 1 or 2 sentence definition. And as far as I know, almost everybody agrees that this phenomenon occurs that I'm about to state in 1 sentence, which is that parental alienation is a mental condition in a child, usually one whose parents are engaged in a high conflict separation or divorce, who allies or aligns with one parent and rejects a relationship with the second parent without a good reason. And that the rejection, second sentence, the rejection is usually instigated by the indoctrination or the brainwashing of the first parent that the child has an alliance with. So it's worth mentioning a few things here. Sometimes the alienating parent, the parent with that the alignment is with, sometimes it's called the alienating parent, or sometimes it's called the favored parent or the preferred parent. The parent who's the victim of the alienation is sometimes called the target parent or the alienated parent. I guess I should, and of course, you know, it's essential to have this idea that the rejection is without justification. Because if the child is rejecting a parent and there is a good reason, you know, like a history of abuse, well, nobody calls that alienation. They might call it something else, like estrangement or justified estrangement or something like that. I'll tell you what else that I slipped into this definition, which I don't know if you noticed, but in the very beginning, I said that parental alienation is a mental condition in the child. And so what we do is we call alienation what's happening with the child and with that rejected parent. That's the alienation. What the alienating parent is doing, we call that alienating behaviors. So basically, in terms of using the words the same way, we say that the alienating behaviors conducted by the preferred parent is what causes the alienation in the child. Now, I got to tell you that not everybody uses these words in the same way. For one thing, some people have different words for this phenomenon. And all, you know, there's different words going around. But we've been trying to stick with these definitions for 10 or 15 years, so I think they're catching on. I did also slip in the phrase mental condition. This is partly connected to my interest in the DSM. You know, DSM is the book of the American Psychiatric Association, which is the Diagnostic and Statistical Manual, which is the official terminology, the official diagnoses. And parental alienation is not a mental disorder, but many people would say that it's a mental condition. That there's actually a difference. So the DSM people distinguish those two terms. Mental disorder is what most psychiatric diagnoses are, you know, like both bipolar disorder or schizophrenia. Mental condition are things like child abuse is a mental condition. It's not a mental disorder, it's a mental condition. Or parent-child relational problem is a mental condition. Or this new diagnosis called child affected by parental relationship distress is a mental condition. So, you know, sometimes people get into a lot of arguments about these terms. But anyway, I just wanted to kind of start out with the definitions that we use. And we hope that gradually people will adopt these definitions.
Yeah, thank you for describing that. So we have a lot of families that go through the court systems today and have, many are really concerned about being alienated from their children. How difficult is this to prove that parental alienation is actually occurring?
Well, when we go to court, it depends on how much of a fight there is, but sometimes there are two stages to what happens in court. Sometimes we have to testify and prove the reality of parental alienation. Sometimes we're challenged on that. We have to prove that this is a real condition, that it harms thousands of children and families, and this is how to identify it. You know, 1, 2, 3, 4. You know, there's a specific way to identify parental alienation. And so sometimes we have to go through that initial stage. And then once we get past that, we then try to show, well, how do you prove that it's happening in this family? Right. And so I can run down the criteria that we use now. For several years now, we've been using what we call the five-factor model. And I'm going to tell you the 5 things real quick, but they're nothing new. I mean, we haven't invented anything here. We have just pulled together the 5 components that have been around for 30 or 40 years. But just real quickly, the first one is that the child is actually rejecting spending time or rejecting having a relationship with the parent. That the child is doing some level of rejecting. That might not be severe, it might be mild, it might be moderate, it might be severe. But the child is saying, I don't want to go see mommy or daddy. The second factor is that in the past, they had a good relationship. That in the past, the child and the rejected parent did have a good relationship. Now, there actually is a little exception to almost everything. And so there is an exception to this. That if you can imagine that suppose a baby is born, and suppose, let's say it's the mother, and let's say the mother from the very beginning prevents the father from having a relationship with the child. It's possible that the dad and the child and the baby never did have really a good relationship. But you know, that's kind of an exception to the rule. And I think most people, depending on all the other things that are going on, that might still be considered a case of parental alienation. But almost always it's possible to show that yes, in the past, the parent and the child had a good relationship. And number three, the third factor is to prove it in court, is there's not a history of abuse, that the dad or the mom did not neglect or abuse the child, so that's why the child doesn't want to go see them. In other words, another way to put it is the child's rejection is way, way out of proportion to anything that parent has done. Factor number four are the alienating behaviors. In other words, I mentioned them a minute ago. That's what the alienating parent have been doing. And they're typical things like they prevent the child from having visitation. They interfere with visitation by phone calls or whatever. They make it seem like the rejected parent is dangerous. In other words, all the nasty things that you have to identify them. In other words, to prove your case, you have to have evidence that those things have happened. And then factor five are the symptoms in the child. In other words, you know, the campaign of, you know, these are the same symptoms that have been identified since 1985. You know, the campaign of denigration, the frivolous explanation for the rejection, the lack of ambivalence, meaning that the child says one parent is totally good and the other is totally bad. So there are 8 of those. So if you've noticed, what I've been saying is the way that we address this is if you look at those 5 factors, all 3 individuals are involved with this. Is we have to collect information about the child and his or her behavior and attitudes, and we have to collect information about the alienating parent, and we have to collect information about the victim parent. And so sometimes it takes a lot of research to do that. I mean, we collect documents and we interview people and we talk to other people who know the family and so on. And sometimes we do psychological testing. But so I guess to go to court is a huge project. And I guess it kind of depends on the jurisdiction, how, you know, attorneys have to figure out how to do this. And sometimes attorneys can just present, I've seen cases where the attorney simply collects information and presents it to the court in a systematic way, and that's it. Well, obviously they have witnesses, they have the mom and the dad and so on. But they don't have me come in, they don't have experts come in. They're able to present it, that if the court understands what they're talking about, that sometimes the attorney can present it in a systematic way, and they make a decision, the court makes a finding of parental alienation. Or sometimes you have to have an expert come in and testify, or sometimes you have to have the family actually evaluated by a psychologist or a psychiatrist, and they come in. So when you actually go to court, you know, it kind of depends on what the attorney thinks would be a good strategy.
How does
it's all sounding very expensive and time consuming, isn't it? It sounds like a very, very complicated process, and I'm very grateful that you're actually standing in that space, Dr. Bernet, and going into court and advocating on behalf of a lot of the children and families and speaking in this space. And I just wanted to say thank you very much for your work.
Well, thank you for your comment. You know, over the years, I think it's actually not quite as complicated now as it used to be. Because, you know, the first step I said, that first sometimes you might have to go in and you have to prove the reality of parental alienation to the court. We don't have to do that so much anymore. At least in the United States, there have now been hundreds of cases in almost every state in which parental alienation has been accepted either by a court or an appellate court, which is even better, an appellate court. Or we recently had a case in Colorado where the concept was accepted by the Supreme Court of Colorado. So we don't have, nowadays, we don't have to prove the reality of the concept so much, but we do have to prove that it happened in this case, in this family. And so that's how we use that 5 factors.
We establish some case law so that there's something to refer to now that's actually existed in another court proceeding.
Right, in almost every state, the attorney can go in and say, hey, there have been all these cases. I mean, right here in Tennessee, where I live, I had a case a couple of years ago, and the losing party appealed it, and that created an appellate record, and the appellate record totally agreed with me and with the judge. In other words, the judge agreed with me, and the appellate court agreed with the judge, and so on. And so that created a really good case, like in Tennessee. And so now other people use that, and they don't have to prove the reality. And so that's true in almost every case, in almost every state. And so I'm not so sure about Australia, but my hunch is that in different provinces or different parts of Australia, that's true also, but I'm not really sure of the details.
I just have a quick question about the child that might have been abducted and doesn't have the option of rejecting the other parent because they just don't exist in that world. So where do they fit into the 5 categories?
Well, in other words, abducted by one of the parents.
Right.
Yeah. Well, I mean, we would consider that a special case of parental alienation, and we would consider it perhaps an extremely egregious case, because abducting the child and totally removing the child from that parent, I mean, is kind of an extreme form of indoctrination. And so even though it's obviously a little bit unclear what the child's opinion is going to be, if the child is found and repatriated and so on, I guess it's a little unclear as to what the child wants or thinks or believes or prays for or whatever. But at least I think most people would consider that a case of severe, in other words, we try to classify how the degree of alienation in the child, but we also classify the degree of alienating behaviors in the parent. Those are 2 different things. And so if you abduct the child, I mean, we would consider that extremely severe level of alienating behavior in the parent.
So I just wanted to speak to that for a moment, because Dawn was abducted as a child and taken away from her safe, loving parent to live with her mother, and then reunited with her father after 44 years of being in that space. So, and I do know also, I've got quite a lot of friends who've separated, and one or the other have moved away out of the territory into a different state, making it very, very difficult for the targeted parent to see the children and participate in their lives and have pretty much anything to do with them. And to fight that over here in court costs tens of thousands of dollars to be able to keep the person within a certain kilometre range. So abduction, or whether it's just taking the child completely away, it's a very, 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 very contentious issue, and happening so often. And Dawn, as an adult child who grew up and had that space, what was that like for you? What would you like to say about that?
Well, it was really difficult because, one, when you're ripped out of one world, that's the only world you knew. Now, my mom had abandoned me at the age of 2, so or both my father and I. So she left us both. She left me with him, and so I was with him for approximately 2 years. He was my only caretaker, and I remember the connection. I remember a lot of things, and I think a lot of adult child survivors have significant memories about those time frames. And it was explained to me at one point that it's because that was part of my identity that I held on to. When I got abducted and forced into this new world, nothing was familiar. So I latched onto those memories. And this new world just kind of felt like I call it my personal twilight zone, because I never felt attached to anything. And going through, even though I had a new family all of a sudden, a new step family, it was never really, there was no bonding or real deep connection. And I often wondered why my mother bothered to take me at all, because we didn't really ever have a great relationship.
Yeah.
It wasn't really strong.
Those are really difficult. I mean, it's hard to really say how tragic and how difficult those situations can be. And there's obviously a huge variation in the different scenarios that happen. And including, you know, kids get kidnapped, not by a parent, but by totally other people. And occasionally those kids get rescued, sometimes after a year or so, but sometimes after 10 or 15 years. It's just amazing. The child was brought up by the kidnappers.
Yep.
And eventually, and the child has an attachment to those people. So these are just horrible, horrible situations that can happen.
One of the things about that is when I was going through I was working on my capstone for my criminal justice master's degree, and I was studying parental childhood abduction and human trafficking. And what I was researching was what happens when the child is found. Everybody goes back to work. The police go look for another case. The mental health workers go work for they find another client or a patient. You know, the schools get back to normal, and the kids like, what just happened? So nothing is there for that abducted child to reintegrate back into a world that they were, you know, maybe taken from, but also maybe, you know, brainwashed, or was told, I took you because they didn't love you, or I did this because I was better for you, or that was a dangerous situation, or that he was a bad person, whatever those reasons are.
Yeah.
Now all of a sudden the child exists in that world, and everybody else went back to normal, and there's nothing normal for the child.
Well, presumably there are people who can work with a child, or therapists, or some kind of program. You know, that in terms of, you were talking about kind of the overlap between abduction and alienation. And I just want to mention an aspect of that, which is, you all familiar with this program here in the United States called Family Bridges? It's an intervention program for kids who are severely alienated, and the children are being transferred from the alienating parent to the rejected parent. And it's an intensive program. It only lasts for 4 days, but then it continues once the child goes back home. And that's to help the child kind of give up the past relationship and get used to this new one with the new parent. So what's interesting is the history of that program. That Family Bridges was originally, the people who are running it now, originally, I think about 20-25 years ago, were hired to help with abducted kids who had been abducted to other countries, and I guess here in the United States, frequently to South America. And these kids would get recovered after several years, and they would need that exact help. They would need help trying to figure out what happened to them, yeah. You know, and especially their attachments. What happened? They have these really strong attachments to the people who committed crimes and abducted them, and now they're coming. And so actually, it's interesting that that's how Family Bridges got started, was trying to figure out how to help those children. And then as time went on and the parental alienation thing took off, now they deal with alienated kids. But yeah. they're obvious, I'm just trying to agree with you, there's this huge overlap between them.
I think one of the things is when you know a child's kidnapped. Elizabeth Smart, for example, she was kidnapped, she was returned home to loving parents. She knew what happened and knew that her parents loved her, and they got her the help that she needed. Right. But when you have a child that's alienated, or, you know, that alienation happens in conjunction with an abduction, yeah. That piece.
Or she was old enough.
And they don't know that they need it.
She was old enough to know what was going on.
Yeah.
And so she never formed an alliance with her kidnappers.
But the ones that are alienated, that everybody goes back to normal, and that child is still sitting there because the parents are not going to suggest that they get help, because they don't think they did anything wrong.
Yeah.
Yeah, it's a very, very difficult space. So with regards to therapeutic treatment, how do we get out there in the community, Dr. Bernet, better ways to teach the community, to teach the mental health professionals, to teach the lawyers, to teach general community members about parental alienation so that they can see what it is, understand what it is, and not, especially the family members, because in our case, like Dawn and I are both adult survivors of severe PA, in both our cases, when we side with the alienator, that then cuts off our entire side of the other family. But nobody ever stepped in and said, what's happening there? Like, they just went along with it. Then there were all the stories, all of that side of the family, all aligned together, believed everything that was being said. Well, didn't challenge it anyway. Whether they believed it, all of it, I'm not sure. Didn't challenge anything. And then that was the pattern that went for years and years and years, that every single wedding, birthday, christening, whatever event it was always, is he coming? No, he's not coming. Are any of them coming? No, they're not coming. So it's just this big thing that the children get put into the middle of constantly. And I think we really need to get some ideas around how better to train community in general as a whole, how to notice this for us and for the kids who are coming through and the generations who are still being exposed to it, because we know it can be very intergenerational, the PA stuff. I know that it's not only my generation, it's my kids' generation and the next generation coming through that I'm still seeing the PA behaviours being exhibited. So do you have any thoughts on that?
You know, the really tough cases, like in your situation, the really severe cases of parental alienation are very, very difficult. And so there are these interventions, and I mentioned Family Bridges. Another point in the United States is called the Turning Point for families. There's one in England called the Family Separation Clinic, I think is what it's called. So there are different programs, and it's really a big job in cases that are severe. But that's not the goal. The goal is to identify these families when it's only in the beginning, when the cases can be classified as mild. And you know, we have a method for the definition of mild, moderate, and severe. But what we hope is to educate judges and attorneys and psychologists and social workers and nurses and teachers to identify these kids in the beginning, because then it almost always is much easier to turn it around. Sometimes in mild cases, the psychologist can sit down with the mom and the dad and say, let's look at what the two of you are doing. You know, this is a mess, what the two of you are doing. Fortunately, Johnny still has affection for both of you, and Johnny seems to enjoy being with both of you, but what you're doing is horrible, and you need to stop. In other words, what I'm really saying is that sometimes in mild cases, a really good talk, sometimes by a therapist or by a judge, we call this the judge admonishes the mom and dad. I'm not sure where admonish came from, but that's the term. The judge admonishes the mom and dad to stop doing and to actively help the child have a good relationship with both of them. So, and that's our goal, is to train judges and attorneys and psychologists and everybody, parents even, of course parents, to recognize this happening at the very beginning. And if that can happen, the treatments and the interventions will be much cheaper and easier and much more likely to work.
Yes.
Just let me tell you real quick how we define mild, moderate, severe. Okay. So we came up with definitions that are very simple. The simple, the better. And the way we do it is, mild is the child says, I don't want to go see daddy. I don't want to see daddy. I don't like seeing daddy. Please don't send me to see daddy. But the kid goes, he gets in the car and he goes. And once he's at daddy's house, he's fine. They get along, he's comfortable, they have a good time. In other words, the child protests, but it's only very superficial. And once they're out of sight of mom's house, he's fine. So mom, and those, as you can see, even if the parents are handling it wrongly, and that's what Johnny says, you can see how that's fixable. Because the child has a good relationship with both mom and dad. So moderate, we call moderate situations where the child says, I don't want to go see daddy or mommy, whatever. I don't want to go see daddy. And the child goes, but he's terrible the entire time. Is he, at least most of the time. He says, I don't want to have dinner with you. Leave me alone. There's very little interaction, but there might be a little bit of interaction. Severe is a kid says, I don't want to go see daddy, and won't go. So as you know, in severe cases, the child hasn't seen the parent for a year or 2 years. In other words, it's dragged on and on. And so that's our simple kind of, and the reason why we need to have these definitions is because the interventions are different. And these statistics are different. You know, if you're trying to do research, and I guess it's called epidemiology, if you're trying to count how many kids are alienated, you have to be able to distinguish. Do we mean mild? There are hundreds of thousands of those, or moderate, or severe. There are probably only a few thousand. So you have to have a standardized method for classifying these cases. What you guys are describing obviously was pretty severe. It went on for a long, long time. And so that's a tough situation.
Yes. Yeah, that's a very different space, because for those of us who are in the severe category, it's very unsafe for us to be speaking about wanting to go and see the other parent. That can come back on us very badly, because we live with somebody who can become dysregulated very quickly if they think we're going to go against them, or even look as though we might prefer the other parent over them. Basically, they are the sun and we are the planets that revolve around them. And if that changes at any time, that dynamic, that can be felt within the house for, you can name the time period, and then they can come back and revisit that with us as well. And we can be punished in all sorts of different ways, depending on how they're feeling at the time. So we're taught at a very, very young age not to mourn, not to miss the targeted parent. We're not allowed to speak about them. We're not allowed to show any signs of love towards them. We're not allowed to want to see them. That's our normal. So we have to learn how to become what the alienating parent wants us to be.
Yes,
so
exactly.
Therefore we never form a sense of self, and nor do we form a voice. So we have to learn that a lot older, and that takes a lot of time, and it's hard to operate in a world where we are enmeshed, and it is a condition. I completely agree with you. Therapist myself, am very aware of what I was exposed to, and I understand the enmeshment very, very well. Yeah. And I also understand how to move out of the enmeshment, but I also understand when I'm being triggered back into the enmeshment. And then I've learned how to stand out of that and just watch it now. But it's a very, very interesting process to learn how to do that. And it is a form of cult-like behavior that we are exposed to.
Exactly. And
to understand that, to be able to move out of that space and have our own voices as well, to the alienator is a very difficult thing to learn as well, because they don't like us doing that whatsoever. And you should see, it's easier if we're adults and doing that, because we have more power, because children have no power in those situations. So we grow up with no power, no voice, no identity. Then when we're older, we can do the therapy, learn about ourselves, how to move out of the enmeshment, how to have our own voice, and then to actually challenge some of the stuff that the alienator parent still says to us, because they can still use lines, even at my age now, that they used when we were very young that can bring you back in like that. And it's the identification of that. And it's a huge process.
Yeah.
That's where my work is, my PhD work.
Too.
So very, very, very tricky.
Doesn't it happen sometimes that when the child figures it out and moves and reunites with the rejected parent and does that, and it sticks, that the original parent rejects the child then? The original alienating parent rejects the child and says, don't come home to here anymore.
Oh, yes. Yes, yes, absolutely. When I still say this, when I was talked into reuniting with my father by a nun that I work with. She supported me and supported me and supported me. I was so terrified of going into that space because of everything I'd always been told about him. He would kidnap us, kill us, things like that if I ever reunited with him. And when I finally did, it was through a lot of support. And then even on the day, I felt so bad about doing it to my alienator. I was still so enmeshed. I actually told her I was going to do it. That was the worst thing I could have done because I've never seen or heard her be so aggressive towards me at that point. Yeah. And she scared me half to death. And I remember ringing my nun and telling her, and she was furious at that point because I was this close to doing it. And she had to talk me back into doing it. And then I did. I rang him. And he'd had a heart attack at that point. So, and he was going in for extensive heart surgery. So he could have died, but he didn't. And I've been reunited with him for 25 years. But that's just an example of the level of enmeshment. And then to move out of that and have your own voice where you're actually able to say, no, that's not correct.
Right.
You need to listen to me. That's not the correct account of the story. Please stop talking. Takes years of counseling.
Yeah.
I'm
That's
still working.
Similar to people in cults. People who have been in cults and who leave go through the similar process that it's very, very difficult to do. Mm-hmm. And then they get educated about, well, how did the cult process work? You know, what were the actual steps of the indoctrination into the cult? And that helps somewhat, but even the intellectual information doesn't solve everything. They still have this kind of emotional connection to having been there.
Yep.
Yeah, we do. We go between feeling sorry for them to being very angry at them.
Even protecting them. There's times that you know, I still have some areas where I protect my mom, and you know, we had a very, you know, we struggled with our relationship. We've been friends at best, probably. We enjoy things like going shopping, having lunch, but we've never had that mother-daughter connection. And so it's been strained. But even then, whenever these topics come up, it goes right back into it, and you get sucked right back into it until you get to the point where you finally stand up and say, okay, enough. And that's what I had to do. I had to tell her that I was looking for my father, and the wheels started going again. And I had to say, I'm not asking you for permission. I'm telling you, this is what I'm doing. And then that's when she stepped back and she stopped with that. But now she's acting in a whole different way where she doesn't call me, I have to call her. She waits for that. So there's the dynamic totally changed.
Yeah.
So now we're on a totally different playing field, and it's really odd.
It's very odd. We're same but different. Dawn and I, we're in different countries, very, very similar, very, very similar, slightly different stories. Yeah. So it's very interesting. But I wanted to potentially move on to maybe shine a light on some of the greatest achievements that you've seen with regards to PA and the work that's already been done, because we know that there are a lot of researchers out there working tirelessly to try and bring about new research in this area to help kids like me and the families that are involved in this. And over the years.
you know, I guess I've been involved with this for, I guess, 20 some years, but, and there have been some accomplishments. I think the major accomplishment is that the whole concept is much better known, that many people are aware that it happens, and now many people now know that there's a name for it, and it's much better known among attorneys and therapists, and it's not poo-pooed as much. When I was first got involved with this, many child psychiatrists would just make fun of it. I mean, they would just say, "Oh, no, yeah, what's that? I mean, that's a silly thing. That's a hoax, or that's junk science," was another phrase.
Yep.
And we really don't hear that so much anymore. We still get criticism, but sometimes the criticism can be much more focused. There's a group of people here in the United States who don't like the words parental alienation. So we had a big kind of debate with them in the last few months. And they ended up saying, you know, we agree with this definition. You know, I just told you this definition a few minutes ago. You know, the child is attached to one parent and rejects the relation of the other and all that. They said, oh yes, we agree that that happens, but we don't want to call it parental alienation. Because if you do that, you somehow, there are different arguments. You give it too much reality, or you make it into something it really isn't. And then they went off on the fact that some people capitalize those words. I mean, what the heck? I mean, in other words, some people, when they write parental alienation, they capitalize it, P-A. Well, I don't do that, but there are some people who do that. And these critics went way off on that. Well, another, my point is that the criticisms in some cases have just gotten kind of silly. They're insignificant, and they're not even relevant. There still are critics. And when we wrote this new book that Dawn has in back of her there.
Can you grab it, Dawn?
It's called Science and Law, Alienation, Science and Law. We had several definite purposes to this book. One was to be able to prove that it's admissible in court. There are certain criteria for something to be admissible in court. And there are 3 or 4 chapters in this book that go through step by step to prove that. And the second thing in the book is there has been a lot of this misinformation. There are people who go around saying things that are absolutely false. And so we systematically go through these different false statements and say, this is wrong because of this is wrong because of this. Some of these false statements are almost ludicrous. Some of them say that the whole concept of parental alienation was a hoax, that there never was any such thing, and there isn't today, and it was a hoax in the sense that it was simply made up. It was the concept was fabricated by this guy named Richard Gardner, and that he did it so that he could help dads in court, and specifically that he could help abusive dads. And so you know, that's ridiculous to say that it's a hoax, because it's, you know.
I've had people attack me telling me that I'm a hoax to even suggest that, you know, I'm not, none of my story is true, that I'm making it all up, and actually said some really even crueler things that I won't even give oxygen to.
No,
that's still going on there. And I don't think it's as bad as it was a few years ago, but I think we've made progress in identifying the sources of this nutty misinformation. But it gets repeated over and over again. So if somebody's telling you that, they've heard it from somebody else.
Yeah.
So that's been progress.
Well, they're attacking the actual children that actually lived this experience. So, you know, maybe sometimes they need to stop and think.
I think
it's like saying child sexual abuse isn't real, or cults aren't in operation. Like, it's just not a thing. We who grew up in that, you have a conversation with us, we are very, it is our reality. It's all we've ever known. So to say that it's not real is quite offensive, because that's all we've ever known. We look at other families and think they are odd, the normal range families. We think that's odd.
Well, we made progress on that. I think it is better known. I think it's better known in courts. You know, there have now been hundreds of cases where it's been accepted in courts. In France,
you for that work. Thank you for that work, Dr. Bernet.
It was accepted by the Supreme Court of France. There was a case in which it accepted the reality of parental alienation. And so there's been progress in that area. I think we're trying to get progress in terms of education. You know, we're trying to get this into the kind of the educational pipeline for attorneys and psychologists, but that's hard to do. There's been progress in research. There's, you know, there's a thing called qualitative research, which is simply descriptive, and there are no statistics involved. But now, you know, there are now qualitative studies from maybe 60 countries. There are hundreds of papers that have been published, and we collected them from 55 or 60 countries. That's just amazing to be able to show that all these different countries are observing the same thing. And now there's also more quantitative research where we do certain kinds of tests, and the tests can show whether they can distinguish whether there's a child alienated or not alienated. So I think there is progress, but you know, we're not at the finish line. We still have a ways to go.
Yeah.
The best outcome is that it's much better known, and that there is much more hardcore research to help demonstrate both the reality of alienation, but also how to distinguish alienation from something else.
Mm-hmm.
And I think there is much more agreement among the professionals than there might have been a few years ago.
That's good.
I'll tell you my concern, though, is that it's hard to get everybody on the same page. That some people want to focus on alienation, some people want to focus on hybrid cases, some people want to focus on estrangement. It's really hard to get people on the same page, and I think we're trying to do that. My other concern about the future, I guess, is kind of to be realistic. You know, I don't think this is ever going to go away completely. I mean, it's just like child abuse. I mean, child abuse has been recognized for 100 years, and there are huge programs, and government tries hard to suppress and deal with child abuse, and it doesn't go away. And the reason why alienation isn't going to go away altogether is because there are creepy people. There are narcissistic people. There are entitled or mentally disturbed people who are still going to take advantage of children and use the children as weapons. And so I think that's still going to happen, even if we educate everybody. There are still going to be people like that.
Less often.
Yeah. Oh, well, no, I think it will be less often. I think it will be minimized. I think it will be identified much earlier when cases are mild. I think all those things are good. I think there will be movements in the court system. You know, there's a whole idea about court system, a family court anyway, should be less adversarial. I think that's going to happen in different countries.
More collaborative law, more mediation.
And there are different movements about shared parenting. I think shared parenting is a good idea. So I think there are movements that are going to reduce the frequency of parental alienation. But
before we go into the questions, Dr. Bennett, I just wanted to know, I just want to ask one more, because this is what I'm seeing in my therapeutic practice, is does PA always originate from the other parent, and are there other occasions where others can also be alienating? It might not necessarily come from the mother and father, because I'm also seeing alienating behaviours coming in from grandparents, where the parents are trying really hard not to do that, but then the grandparents are coming in with...
Yeah, definitely grandparents get involved both as perpetrators and as victims, because children are getting...
And the transgenerational, because my mom...
Occasionally, therapists, sometimes there are kind of fanatical therapists who take on a case, and they get convinced that the child should be with one parent and should avoid the other one. And these therapists are very dangerous. And there's another thing that happens in Europe. I don't know about Australia, but I've heard about it in Europe, where the social workers attached to government agencies, you know, like child protection agencies, that they get fanatical, and they
Yes.
get to where they're somehow they think it's their mission to help the child never see this other parent again. I've heard that quite a bit in Europe.
Seen that.
So you're right. I think there are people other than the parent that makes this happen.
Yeah.
It's very concerning because to have the two parents trying to work through it and then have a grandparent come in who's an alienator to try and move into that space that's a very, very, very awful space. So, and just on that note, just wanted to mention the grandparents out there who are part of the targeted parent group who are not seeing their grandchildren, and that is heartbreaking. And I just wanted to say we hear you on this channel, and how important that you are, and what's being done in the courts with regards to grandparents, Dr. Bernet, because what sort of rights do they have? This is possibly a question a lot of people may want to know too, because they're sitting at home missing their grandchildren so much, or when they see them, they're under such severe control with the child that alienating parent may not even be out of the room at any point, or like,
it's, you know, the rights of grandparents depend on the country and even maybe even the state. But it's sad that in a normal intact family with a mom and a dad, the parents are totally in charge of those children. Those parents, if they want to, they can exclude the grandparents.
Yep.
But there are circumstances that the grandparents have legal rights. For instance, suppose the grandparents were the primary caretakers for a period of time. That gives them some kind of legal right in some countries. So there are some circumstances where the grandparents do have more rights, but usually it's up to the parents to make that happen.
Yep. And sometimes, at least like even in Australia, where the Aboriginals have more rights as far as that, the lateral, like the grandmother, the mother, aunts, they all have interactions with, you know, almost equally.
Really?
Yes, that's our Indigenous population. They are very, very, very amazing when it comes to family. Everybody is family. They all have equal status. The grandparents, the aunts, the uncles. It's a beautiful system, and our Aboriginal community really.
That's interesting.
We need to look at how they're modelling. But that's amazing what they're doing. But with my grandparents, I wish they had some rights to see us as children and had stepped in and said, we want to see them, we want time with them. I wish that had happened, because by the time I'd reunited with my dad, they were past.
I know, that's hard.
So, yeah, so just flagging it.
Let's see if Dawn has 2 or 3 questions here.
Yeah, I just want to add that I have seen where my mom came in and kind of participated in that alienation when I was going through my own divorce. So I've actually seen that happen and take place. Whoops, I'm knocking things over. So one of the things I want to get to, the first question I'm going to ask is actually from Kristen Pryor, because it was the most recent comments that you made regarding the court systems and that kind of stuff. She's asking, it's still very sad that in Seattle's where she's at, it's still alive and strong in the family courts, but with the gals and all of them, how can we reach the guardian ad litems and the counselors in these court systems?
You know, we need to do that. That's the whole thing about educating the legal people, the psychology people. We've started to do that. Not just me, I mean, lots of people try to do that. And sometimes we get through to them. Sometimes the guardian ad litem is totally ignorant. Not always. I mean, I've had some really informed guardians ad litem, so I know that some of them are doing okay. But it's a big job to try to educate these people.
Yeah, I'm a guardian ad litem, and I actually tried to show in my region. I took the Erasing Family documentary and it was in service. It was educational. We're required to educate so many hours per year. I mean, who doesn't want to see a movie? And I got, I think, 6 people to show up.
Yeah.
So it's really hard to crack into that. And I'm a guardian ad litem myself, so that's difficult. So let me go through here a little bit, see what kind of questions we have. Lots of comments in here. Courts are promoting. Kristen also mentioned Linda Gottlieb has a reunification program, and Dorsey Pruder also mentioned the High Road that you might have, I think you participated in Tennessee. There was a case that you were involved in?
Yeah, that's another program called the High Road that I'm aware of the program. And Dorsey and I had a case that we were both involved in at the same time. And so, yeah, that's another program.
Yeah, so there are programs out there. Maybe we're starting to get a little bit more. I know people are talking about more programs, trying to create and develop more programs. So we definitely need to see some more. Let's see. Every time I scroll up, it scrolls back down. So William McGee says, it's great to see you, Dr. Bernet.
Hi, William.
Hi, Bill.
Stephanie Larkin.
He has a good book too, by his book.
Yes, half the child.
Half the child, yes.
I actually have it here somewhere. Stephanie Larkin mentions that the children should have a voice, and then I think a secondary part of the comment was that being under duress, the children would be under duress more or less to talk. She says that she has an extreme physical restraint being done a 3-year-old. Judge is not looking at the admissible evidence. What do you do from there? That sounds like a lawyer question. You might need to consult.
I don't know. It's hard to really address individual cases. It's because there are so many specifics that you would have to know.
Right.
That would be very difficult.
But these are always difficult cases.
But valid. I mean, I get the question. Brian Hart, he says, Dr. Bernet, what are the initial books or other educational methods do you typically recommend for targeted parents just learning about education? My guess is that the book Divorce Poison.
Yeah, he's talking about Divorce Poison is this book by Richard Borshak. And that is a good starting point. That book has been translated into Korean, Japanese, Czech, Lithuania, a couple of other things. And I believe it's the most widely read book in the world, Divorce Poison by Richard Borshak. So that's a good starting point, but there are a lot of books, and on our website we have books by members of my organization. I have this group called Parental Alienation Study Group, pasg.info, and so we have if you go on it, as a resource, there's a whole list of books by members, and then we're also developing list of books. 2 sets of books by professionals, for professionals, but also books for parents. And so they're going to be posted on the website in a few days. And so there actually are lots of books. Some of the most poignant books by parents, of course, are written by other parents. There are these, actually the William McGee book is an example of that. But there are lots of books by parents that are interesting. Sometimes they have sad endings, sometimes they have happy endings. But they're really useful to take a look at.
Okay. We have another question from Kristen Pryor. For those being victims of alienation, so I think for you and me, Alyse, how did and do you handle feelings of guilt for alienating that parent?
Well, for me, guilt wasn't really something that I experienced, which is a little bit outside the research. It doesn't follow along with what some of the research says, because for us, I didn't feel guilty about not seeing my father, because I was 4, 5, 6 when the most severe of the alienation was taking place. So it's something that I've never known anything differently about. So feeling guilty about the way that I would not want to see him or was so terrified of him is a bit incongruent for me, because ours was more terrified, not necessarily, it wasn't coming from me, it was coming from the alienator, and the enmeshment is what I was brainwashed to think. So I didn't have any cognition around that it may not be okay. It was just our normal to hate him and be scared of him, even though I loved him as well, because I did have a big connection with my dad. We would have the occasional contact visits. So it's a very incongruent space for me to have lived in. So to say that I felt guilty about the way I was with him, I don't at all, not one bit. I think that I missed him like crazy, and on the other hand, I was terrified of him. So it's a very weird space to grow up in when you're a child of severe PA.
Yeah. And mine's similar, where I didn't realize that about the alienation at all. I just knew that he was gone. So I didn't have that guilt aspect in there as well. But I knew that I wasn't allowed to speak about him or talk or even refer to him as my dad, because I had a replacement dad the day I was taken. So I was only allowed to call him dad. And so anytime I wanted to refer to him, I would be shot down and only allowed to use that word for the other person. So my guilt didn't really set in until after I found my dad. Then I felt really bad that I was ever afraid of him from what my mom had told me. I felt bad that, just things that weren't even really my responsibility. I had to go through that whole guilt wheel.
Yeah.
And really kind of put things into perspective of what do I own? And the therapy is what helped me. So, I think it's important that we do speak with a therapist to help us transition through these thoughts and put them where they belong, and put the onus of that guilt on the person that it belongs to, and not hold it ourselves. So thank you for that question, Kristen. Let's see, what else do we have? Let's see, is that a question? Oh my, it says dealing with this. Okay, so Jessica Anthony is dealing with some of this right now, something that we've been talking about. How many lies does my husband have to show on the record? We are over 50, so we're talking about the numbers, where I think with the judges saying, I saw that, we see that you've been in contempt 60 times, so now you're going to go to jail. So I think that's what she's referring to here. It's documented perjury. Let's see. I wish it would scroll smooth. I think some of these are just comments. That one I already asked. Okay, Jessica Anthony also asks, if the custodial parent is illegally trespassing in an abandoned state hospital buildings full of asbestos with their 14-year-old child, and then lying about it after caught, would you say that's egregious neglect or endangerment? Yikes.
That's a pretty difficult question to ask any of us, because we just don't know the context or anything. I think that to answer that would be very hard.
Parenting. And maybe it's a form of neglect, but it certainly seems like bad parenting if you can show that actually happened.
Very questionable.
It's definitely dangerous stuff. Fight Parental Alienation says, why is it hard for people to see that child's behavior is not normal?
This is tricky, Dr. Burnett.
People see things from their own point of view. So superficially, the child's behavior, if you only know this family because they're your neighbor or they're your cousin, superficially, the only thing that you see is the child says, I don't want to go see daddy. That's what you know about, that's what you hear. You don't know enough about the child to identify these other symptoms that he might have. Like that splitting or lack of ambivalence or their frivolous rationalization. You don't know. All you know is that kid doesn't want to go see mom or dad. Well, so you said, well, why would that be? Well, so people assume that that's because dad's not a nice guy. In other words, that is the simplest explanation. And to think, and especially if you happen to know mom and you just know that mom is a wonderful person, it's hard for you to imagine that mom is indoctrinating the kid to have those feelings. I mean, that's why it goes unnoticed, because the natural tendency is to look for the most obvious explanation for why the child doesn't want to go.
And a lot of alienators, I've noticed, especially from my experience, present to the world very, very differently to how they present when they're in the house with us. It's a different person almost. They take off one mask, they're seen this particular way out there, and they take it off when they're at home, and then and you won't get to see that. So that's why it's very, very difficult to side with someone who's going through a separation or a divorce and saying things like, my ex has done this and that and this and that, and this is why you sort of need to be hearing me. You need to be very careful not to align. You just need to stay really unbiased, like out of it, and just try not to get into that story, like, and this is what happened, and then spread that around, because I know for a fact that every time my father comes anywhere near a particular town, he starts to get panic attacks because he knows that the town believe all this stuff about him. So that's not necessarily real. So you've got to be careful in that space.
Yeah. How about one or two more comments?
Okay. One I'm going to type in the chat room. Question is, what's the number for reporting child abuse, along with a pretty long story. So when you want to report child abuse, it's 1-800-4-A-CHILD. So you can call that
in America.
In America. And now I got to scroll back up. Okay. Let's see. Inappropriate use. I am sure that alienation exists, but in cases of documented abuse, how do you combat its inappropriate use?
Oh, now that's possible. That yes.
That was for Annie.
Sometimes people make up stories of parental alienation that are false. In other words, it happens on both sides. You know, domestic violence is real, but sometimes there are false allegations of domestic violence, or the same thing. Parental alienation is real, but occasionally there are false allegations of parental alienation. And how do you combat it? You have to do an evaluation. You know, you have to look for, are those 5 things present, the 5 factors that make up parental alienation. You know, you have to look at data. You have to look at evidence to try to figure out whether it's real or it's fabricated.
Yeah. Yeah. So, Jessica, I think I'm going to combine some of your questions where you have a situation where you're, one of the parents that's being alienated from his children is also being alienated from his own parent, who is also aligned with the ex. How often and how frequent is this occurring?
So that sounds like what is one of the ways that transgenerational alienation happens. You know, where it happens, suppose there's a man and it happened to him when he was a child. He was alienated from his dad, and now he grows up and gets married, and he gets alienated from his children. So sometimes it happens in that way. That's one transgenerational phenomenon. I guess another one is, suppose there's a grandmother who gets rid of her husband and has a daughter, and then she gets the daughter to get rid of her husband. So that's another transgenerational thing. And so there are different scenarios that might happen. And, you know, people who do investigations actually document these things pretty well. I mean, they go back and they say, well, this is what happened in the 1950s, and and this is what happened in the 1970s, and then this is what happened in the 1990s. I mean, it's really fascinating how sometimes you can reconstruct what happened in one generation after another.
Yeah.
We can do that through genograms.
Yeah.
As soon as people come in and look at all the different emotional cutoffs and events and things that can lead down to the behaviors that we're currently seeing in the room.
Yeah.
Can
I
you
would hope that if people do that, they would learn from it to not let it happen again.
Yeah. Can you describe the genogram for our listeners?
So what you do is you get a family history, and you basically, you know, the mom and dad are up here, and then they're below them are the children, and then higher than the mom and dad are the grandparents, and higher than them are the other
So
grandparents.
like a family tree.
And then there's like a family tree, and then there are siblings that go off, aunts and uncles and siblings, but I mean, that's just the structure of it. But then what you, in a genogram, if you're doing a family, kind of a family analysis, you fill in the major characteristics of these individuals, like is so-and-so alienated from one of his or her children? And if so, who instigated it? And then you also fill in other things like mental issues, you know, that so-and-so has schizophrenia or something like that, or physical illnesses, or who has died and what did they die from? And, you know, did they commit suicide and so on. So you fill it in. But sometimes it's really interesting because you can go back some generations and you can all go off to collateral, and sometimes you can see patterns that you don't see just in everyday conversation. And so I think that's what family therapy people try to do. And so sometimes it's real helpful.
Yeah, it looks a little bit, I don't know if you can see these, but these are some of the symbols that we use.
Yeah.
Oh, yeah, I can see that.
So we can put something like this together, you know, in an hour or so and get a really good picture of the family, the historical trauma and things like that very quickly. So, yeah. Any other questions or comments or anything?
Lots of comments. I'm trying to pick out some.
Yeah, how about one more question?
This one's not really a question, just a comment. We need, this is from Fight Parental Alienation. We are at the, whoops, it keeps jumping on me. Come back down here. We are at the very early stage of this battle wherein we are working to create awareness against PA to stop it from happening, which that's what we are doing here right now as well. We need proper reunification programs wherein the child is made to not hate the other parent post reunification. I would not want my daughter to hate her mother. That's what we need parents to realize, is that we do not want your children to hate the other parent,
right,
because that's who we identify with, and that is our other half.
I think all that's true, what that person said. All those things are very true. We are at the beginning. We kind of, I think we've crossed some bridges and we've made some accomplishments, but and we kind of know the road, and so we kind of know what we need to do, but we need to keep doing it.
Yeah.
Well, on that note, should we say good afternoon and good night to everybody?
Yes, yes, we will. But don't go away, Dr. Bernet. We're going to hang out for just a couple minutes afterwards. But I want to tell our listeners, thank you so much for joining us tonight and for all of your comments and your questions. Sorry I didn't get to all of your questions, but it was a great night and glad you all were here. And if anybody wanted to reach out to you, Dr. Bernet, would you like to provide that information?
Well, my email is the best way, and that's my name, William.Bernet, B-E-R-N-E-T, at VUMC, which stands for Vanderbilt University Medical Center, .org, O-R-G. So that's my email. But also, you can just go to my organization, and it has a contact us, and that's www.pasg.info, I-N-F-O. And if you go to that website, you can peruse it, and there's a contact us. And if you do that, I see those messages.
And
So,
lots of information on that page as well.
Thank you, Dawn and Alyse, for your hospitality. That was really nice. And it's been a great conversation that we've been able to have. Thank you.
Yeah.
Thank you so much, Dr. Bernet. It's definitely one of our, it's going to be an interview we won't forget anytime soon, that's for sure. Thank you so much for your time.
Okay.
All right. Thank you, everybody, for being here, and we will see you next week.
Yeah, bye.
Bye-bye. Okay.
Okay, so how's everybody feeling? Anybody get triggered or upset or anything during the interview? You all right, John?
I'm fine. Yep. No, this is.
I thought it went very smoothly. And people, you know, people ask really good questions. I mean, in situations like this, people have their own experiences and they're tuned in. And so the kinds of things that people bring up are usually very, very pertinent. So that's good.
Yeah. Yeah. And then we had some parents in there that were struggling. Of course, we see that quite often. But I saw some other people jumping in and answering and trying to console and whatnot. So I think they're okay.
Okay. So can we get a quick photo and then let Dr. Bernet go to bed or whatever it is that you need to do at this point?
Sure.
Yeah,
So
well,
we usually take a screenshot, but we like to talk about it first so that we can make sure we're smiling and.
okay.
Yeah.
Let me know when you're ready.
Okay. Okay.
Okay, here we go. And then I have to check to make sure everybody's eyes are open because I always shut my. Okay, good. That one turned out really good.
Okay, thank you.
First time shot.
Good shot. Well, thank you.
Is that okay?
Is there anything?
Yeah,
are you okay? Are you okay to go now, Dr. Bernet? Nothing? Any
I'm
loose
fine.
ends you want to tie up?
No, I'm fine. My wife has been faithfully waiting for me in the other room.
Tell her we
Okay.
thank you for sharing you with us tonight.
So we're going to head
Yeah,
on and so on.
Okay.
But anyway, thank
All right.
you very much for doing all this organizing, and stay in touch, and maybe I'll see you on the campus.
Yeah, one day
Yeah.
when I see you in person, I'm going to have you sign my book.
Now, you know,
Yes.
we're tentatively scheduled to be in Australia.
Oh, okay.
Well, you know, the PASG meeting is supposed to happen in Brussels, Belgium in the spring, in April 2021. And we're tentatively going to have our meeting in Australia. This has not actually been announced, so it's a secret.
Okay, I won't say a thing.
In the spring, or I forget what month, May or June of 2022. So
Right.
we try to have a conference once a year, and
That would be
we're
awesome.
shooting to be in, I think where Amanda Sillers is.
Yes.
Is she on the western end of Australia?
Yeah, she's on the eastern side. So unfortunately the Eeny Meeny Miny Mo conference was cancelled this year. Unfortunately.
Yeah.
It's May, June is our autumn.
Right.
Almost winter. Yeah, 1st of June is our winter. So better wear some woolies.
So hold on to your book and I'll sign it for you then.
That sounds
Wonderful.
great.
Wonderful.
Thank
you so much.
for being
Okay, y'all take care.
Okay, bye-bye.
Bye.